You're live.
3, 2, 1, go.
We're back after a week off. It wasn't technically a week off because we were at Murph, and I was sore for a week.
I got small ass biceps.
You are starting to get a little more jacked, dude.
Dude, I'm pretty thick.
You're getting pretty thick. I noticed that last week. Your shirts are getting a little more filled out.
I keep telling Andrea, I was like, oh man, the shirt's getting small. The shirt's small. Did you wash in hot water? And she's like, if every shirt is small.
Did she show you the thing I tagged her in about? It's like a male goes on a diet and he takes out his creamer out of his coffee and loses 10 pounds.
Yeah.
And then the woman one's got like all this stuff and it's like gained a pound. She was like, yeah. I was like, this is Mark. She's like, yeah, asshole.
She hates it, but she did Whole30, right? That was one of the main nutrition things we did at the gym.
Yeah.
It was like a whole gym. And she gained weight. And she was strict. She was so pissed. I think she's still scarred from that because like anytime we do anything,
yeah,
it's so hard for her to.
Because I was like, I picture you going, I ate like 7 times today. Oh man, I lost a pound. Shit, I hate when that happens.
Yeah, she's
and
so
her
angry.
Sitting in the background going, God damn.
Especially because she's fasting now, and so now like for the whole morning I'm like stuffing my face uncomfortably.
And it's making her crankier.
Yeah,
because she's not eating. Oh.
Because
no coffee too.
She's doing coffee.
Oh, okay, good.
But it's the opposite because like she can't eat, and I'm over here bitching about eating.
Right.
I'm like, oh gosh.
Those are not a good.
I'm not hungry. I gotta eat.
She's like, I have an 18-hour fast here. I gotta eat 3 times in that 18 hours. Oh, this sucks.
I do have to call her out. She's gonna get pissed, but she just told because she doesn't do any FixFit at all.
Right.
And she came to see you.
Low back hurts.
Low back's been hurting.
Yeah.
And I keep telling her, hey, maybe try. And she's like, I don't listen. Everyone else is telling her, and everyone in the gym's like, why don't you try this? I'm not going to listen to Mark. I can't take a class. Mm-hmm. Well, it's cool that I talk about her. She hasn't listened to one podcast yet.
She doesn't listen to FixFit any principle at all, in any format.
And then we're hanging out at night, and she's like, about to say something. And she's like, no, I'm not going to say it.
Uh-oh.
And I'm like, what? And she's like, no, you're going to get all big-headed. And it's like, whatever.
Uh-oh.
And then so I was like, and then an hour goes by right before bed, and she's like, yeah, I've been doing those, I showed her one thing, the glute hip-ups.
Yeah.
And she's been doing it because after class, during class, wait, what should I focus on? Should I focus on the holds or the reps?
Yeah.
And so now her back feels way better. And she's like, oh, I'm going to do that after every workout.
Yep. Like I saw her after, I was like, maybe some oblique firing of some sort, but I'm not going to go into detail because what's the point?
Yeah.
But you know what you need to do.
She's always been a late adopter of things. Like, we started the gym in our garage. She hated it for 2 years. Didn't want anything to do with CrossFit. And then even to this day, she's like, I don't do CrossFit. I'm a weightlifter.
Yeah, I agree with that.
So it's been 3 years of
That's very relatable for me. Well, I lift in various formats at a high intensity sometimes.
Functional movements at high intensity. But it's not CrossFit.
But right now, it's all about deadlift, strict press, and back squat. That's the focus for the next, 30 days? Till July 4th?
Yeah, because most of the people listening are our peoples. So I recommend...
Our peoples?
I told them that we have this lifting comp, so it's a good time to train for something.
Right.
And this is a unique structure where you can choose to do the snatch, clean and jerk, back squat, strict press. I think some people might even do bench press. And then deadlift. But you can pick to do 1 or 2.
Or all 5. That's pretty cool.
But, like, you can do a clean and jerk and a deadlift. There's no other, like, event like that out there.
Yeah.
So, at least it gives you something to train for until 4th of July.
Dude, and then you go to the pool after, super swole.
Depends what lift you do, right? I don't think the deadlift will do much.
I'm excited for that. This week we want to go over knee pain. Probably a part 1, honestly. Yes. Honestly, any of these episodes, because I was like, maybe we should do a shoulder pain one. We already had a shoulder pain, headache one, but I'm like, there's just going to be various parts, because...
There's more to the shoulder than just migraines and certain, like,
we barely touched it, right? And then, so knee pain, too, is just like, this is our overview. More of like if you were wondering why your knee hurts, these are the avenues you can go down, possibly. But it's really going to come down to the first thing I think of right away is what happened, right? Mechanism of injury. So, like, was it acute? Did it just happen? Like, did you hear a pop? Were you jumping and you heard a pop? Did you land and hear, you know what I mean? Or was it repetitive? Was it from running? Was it from
Majority
squatting?
of the time, it's chronic issues.
It's usually chronic, yeah.
I mean, we've had knee injuries, like, ourselves and members, right?
Yeah.
But that's, like, the serious ones, that's different, but that's rare.
Yeah. It's more rare, but then also, if we have athletes listening that are training in a sport, jiu-jitsu, you get caught, your leg gets caught up, you get knee barred, you hear a pop. There's different...
Soccer player, ACL, LC, all that stuff.
Basketball player, so...
Meniscus.
Mm-hmm. So typically what I'll see in my office, we treat a lot of athletes. I heard a pop, I landed on it, cut in soccer, heard a pop or strain. I went to urgent care, they shot an x-ray that shows that nothing's broken. I'm like, well, that's good. Let's look at the ligaments now, because that's what's giving you a lot of pain, right? Ligament
pop probably
overstretching and inflammation, yeah. You get a lot of pops. There's a lot of capsules within your knee that pop. And that cause inflammation when your knee swells. Your meniscus could just get aggravated too. That's another very common thing I see. Like the meniscus gets irritated, inflames, gives you a lot of pain, but that doesn't mean it's torn. And I just tell people, if I structurally feel it and take it through an assessment and take you through a squat analysis, and you're like, yeah, it's there, but it's not like debilitating, and the ligaments feel strong, everything's intact, I'm like, time will tell at this point. So now you have to conservatively treat it, ice, Epsom salt soak, and other things that we'll get into later. But I'm like, that's temporary right now.
Do you assess people for that?
Yeah.
Like, you get a lot more athletes in teen sports or whatever. So
especially teens, they'll come in and their parents will be like, the knee popped.
Okay?
He says it popped, and then I check all the ligaments, and it's super strong because they're young, and it didn't. I mean, they obviously walked into my office too. They didn't limp in or have like a crutches or something like that. And I'll give them some exercises to do some FixFit movements. But yeah, we've seen other things too. Like here's a popular one for kids, soccer players. Front of the knee pain, from hyperextension of their quad.
Yep.
Which is a different kind of assessment to have. But I guess we'll get into those kind of things later.
Cool.
But we always look at mechanism injury first and take them through an assessment, right? So in my thing, I see acute injury. I rule out that something's torn and I don't have to refer it out, or I do have to refer it out for MRI. But what we're going to talk about more is chronic. So someone that...
That's what I normally see.
Yeah.
They did a workoup, their knees hot, there's hot spots,
right.
They have pain, and I always ask them, is it the front, the outside, the inside, the back? Because usually it leads to something else, but it's all chronic based. A lot of the times it's like, I went for a run, or they're doing a lot of squats, whatever it is. I went hiking.
Right.
But it's all chronic stuff.
Yep, popular one.
I mean, in the beginning of our CrossFit journey, because you just wanted a PR every time you picked up a barbell, there's probably a lot more serious. The severity of the injury that we talked about before was greater because, I mean, you're firing on all cylinders trying to hit PRs with the imbalances getting worse. But nowadays, I don't see as much those type of injuries. It's more just chronic based because we're always assessing every single class anyway. So finding the right modification. So for me, most of the time, I'm a movement guy, so I will try to assess movement to fix chronic type of issues.
Squat first, body weight, functional squat. Yeah,
so hinge, and it starts with the hinge pattern, the hip, and then it starts with the knee.
Well, the knee is a natural hinge joint, right? So I educate my patients that you got the femur sitting on top of the tibia, you got a bunch of ligaments that hold it together, right? And really, your meniscus is just like a brake pad, right? So it's just cushion. And if you're imbalanced in your hips and your core is weak, and you go to do something like a squat, like a barbell back squat, and you unhinge your knee, but you're not evenly unhinging it, you're going to compress something, right? Yeah. Something's going to give. So you're wearing out that brake pad, whether it's on the inside or the outside. So that's like bread and butter, like 101 knee stuff, right?
Yeah.
But for us at the FixFit level, we go, what muscles are causing that imbalance to make your inside knee hurt versus your outside knee versus the back of the knee?
It trips me out because, like, when you ask me, right, what do you do first if someone comes with knee pain? And it's almost backwards from what I've been taught. I played a lot of basketball growing up, and I remember waking up many nights where it would be in pain because it's the wear and tear.
Right.
And I went to doctors and chiros.
Too much compression.
It's like, it's just wear and tear. You've probably got no more soft tissue left. That's just the way it is. You're going to live with it. And I was like 15.
Yeah.
And so I have been to that point where it hurts so bad every night and there's no hope other than just stop doing what you, like stop playing basketball. But now I've never had that same pain again.
Yeah.
Because
you stopped.
Well, the thing is, I've been strengthening everything causing that.
But you also took away like basketball 5 days a week of jumping and.
Yeah, but squat cleaning, wall balling, box jumping. I mean, there's still a lot of bending at the knee.
Right.
But I guess the impact's a little less.
That's the thing is like bending at the knee. A lot of people, like we'll get into, I'm sure, is initiate all their movements with their knee.
That's why it's not a knee thing for me first. It's like I hate when people blame the knee and the ankle.
Yeah.
Ankle mobility or the arches. And I used to go down that route because we all have the same kind of mass, education of these things. Oh, your arches collapsed.
Right.
And I've been down that route, like, oh, it must be ankle mobility, your dorsiflexion, or your ankle, whatever, all that shit. And I went through that process, but then it doesn't make sense because I've had orthotics because I have flat feet, because I went through the same process, knee pain, orthotics, the whole deal. But I kept doing these arch exercises, and then after a while, I'm like, how the fuck are the muscles in my arches gonna be the main problem?
To drive your hips.
To drive my whole fucking body. So you're telling me if I did all these little, like, I put a coin in my big ball of my foot and pulled it back, doing little arch curls and stuff to improve my foundation.
Yeah.
It's important, but what comes first? So if I keep doing these arch support thingies for my foot, is that going to ever be strong enough to hold up the barbell for a 300-pound squat? To do a jump and land? Or even when I run with my, if I run and I land on my foot, if I'm not using my core, my glute, my hamstring, my calf, you're going to expect that fucking arch of that foot to do all the work to save your Achilles or your, plantar.
One little missing link in the chain, I guess.
And that's what we're saying, it's backwards, right?
Just think, get brand new tires on your car, get new brake pads, new rotors. If your car is out of alignment, it's just going to wear out the same again anyway.
Exactly.
So it's like, buy the fanciest fucking tires you want, buy the best orthotics you can, buy brand new brake pads that are just top of the line. So I got new knee sleeves from Mark Bell and all this other shit, and I got compression. You're still going to wear out that area if your hips are in your core are in balance.
Orthotics is a good idea, right? On paper, it's common sense, and if you're not going to do shit about it, I would say use it.
Prevention. If you're standing at your job for a long period of time, you would want some arch support for your feet, but that's not the fix.
That's not the fix. So I would recommend, and my arches has gotten way better, but if I stand like shit, I can still demonstrate I do this often without shoes on, showing how flat my foot could be and how collapsed my arch is. But you can work on that. But the issue is you can't work on the arch itself.
Right.
Because what I always tell people, the analogy is, okay, let's say I'm running. I weigh 180 pounds now. So when
so fast.
Before, I think a month ago we're talking, I was like 166.
Ooh.
So anywho,
thick, girl.
I'm pretty thick. That's why we got the wide lens on the camera.
To fit both these shoulders in.
So if I land on a run step, 180 pounds of that weight is being absorbed into that orthotic, right? Yeah. Okay, well then you have to strengthen your arches, your dorsiflexion, all that shit. Great. You're going to want 180 pounds just on the muscles in your arch and your calf. But the analogy is I want that 180 pounds to be spread out through as many muscles as I can, so not one joint, like you said, gets worn down too fast. Right. So if I flex my obliques, my pec, my glute, my inside hamstring, my calf, it's like everyone's doing their job, then everything's going to fire together. So it's not really just like the arch itself or doing all these knee exercises.
Yeah. What do you think is the most common knee injury you see? Chronic.
If it's running, it would be outside knee. CrossFitters get inside actually CrossFitters have like they just have knee issues all the time.
Yeah, just general swelling in there all the time.
General knee issues. But
I would say I'd see more outside knee pain from CrossFitters.
Because the reason is if you look at any weightlifter or CrossFitters, and CrossFitters hate cardio, they like barbell stuff, so they always have a bias to weightlifting.
Yeah.
And so like they won't really push it on cardio workouts, but when it's squat day, clean day, or whatever, they'll go harder. So if you look at any weightlifter, CrossFitter, they're built the same in terms of which muscles are overdeveloped in their legs, and their outside quads are massive.
Let's get into the knees out thing then, because that's exactly what I was going to say. Is the reason I see outside knee pain on a CrossFitter or a weightlifter the most is because you have a glute. The glutes are triplanar, which we've said before. You have that glute med sitting at the top of your hip, right?
Yep.
And the piriform is pulling your hip in external rotation. So if you're initiating and bottoming out a squat and getting out of a squat using just the glute med and the piriformis, and your hips are in external rotation, of course your outside of your knee is going to get externally torqued, right?
Yep.
So that's where they get that wear and tear over and over and over. And that's where we've said 100 times, joint cue, knees out means your outside of your knees are going to take all of that force and compression. The glute max and the inferior part of the glute at the bottom of your pelvis, if that's not helping you drive out of a squat, which would also give you more power, it would take a lot of pressure off the outside of your knee. And we don't see people doing that enough.
That's such a loaded topic. I'm like, my head's about to explode.
Knees out cue?
But let's start it this way. 3 years into, so it's been like 10 years of CrossFitting.
Yeah.
And then we caught Kelly Starr at Mobility WOD Guy. Everyone listening should know by now, especially if they go to our gym. And we had a huge influence. We took his seminar, you know, and it was mind-blowing because this is the first time we got mechanics, like anatomy and how things move,
right?
You know, actions of muscles. Like
the first guy that got away from technique and looked at biomechanics in your sport.
He was a PT.
Yeah.
He is a PT.
Oh, is he? I didn't know that.
He is a PT by nature, and so a lot of his drills, the voodoo flossing and all this, shoulder capsule work, SMR, it's all PT drills.
Yeah.
And he was a CrossFit gym owner, so it's cool to pair the two up.
Right.
And the good of it is I learned so much. It was like a introduction that the body, I had to learn a lot more about mechanics.
Sure.
And so we applied his methodology for years, and that's actually what made us stand out for a long time.
Getting an external rotation.
Well, just even like most people will come back like, man, I thought it was like they'd go travel and they'd come back like, this gym didn't do any mobility WODs. This gym didn't even have a foam roller.
Yeah.
And to us, that was, for our members, that was like common. Like we would roll out tight muscles. We'd work on mobility work to get a lower overhead squat. You know, if your knee hurt, you roll out your IT band, and then the pain goes away. And then when you had inside knee pain, you roll out your VMO, and then that goes away.
Yeah.
It was like a huge introduction to that. So there's all good things, but from what I've seen, is he taught external rotation for everything in the hip, for movement.
Yep.
And now that's proven to be wrong for a few people out there. A lot of weightlifters if you look up, he had a time where he was arguing with all the Olympic weightlifters.
Really?
Yeah, you can Google it. So Greg Everest, there's a lot of the Chinese lifters that didn't agree, and just like, because they're both the most kind of popular strength and conditioning people out there. And so I like that cue external rotate to get low, to build hip stability. It makes sense on paper because, like you said, the glute med locks into your your pelvis, and then your pelvis is locked, so it should be safe. But if your pelvis is locked and you're squatting, then you have to hinge somewhere, and then it's all erectors lower back.
Yep.
And then the knee takes a huge shearing force, because if you externally rotate, try that out, look it up, whatever, and externally rotate as hard as you can when you do any like air squat. Your hips are like locked. Your glutes are locked and your SI joints locked, so you can't bend at the hip. And if you watch a slow motion video, the only way to get down is your knees will bend, then your lower back bends. Your knees are bent, lower back bends.
Yep.
And that idea of applying that PT mindset of how the hip should the actions of the hip probably ruined so many knees. It ruined my knee for a long time.
Probably ruined a lot of hips too if you got to a heavy enough weight.
Low back would always go.
SI joint sprains.
Because I was lifting off of that idea where at least, you know, it was good because it's better than not thinking about mechanics at all. But we had to go through the trial and error of like fucking up our knees and lower back for a long time. understanding that, in terms of movement, it's just not right.
Yeah. And then if you ask somebody, what have you been doing for your outside knee pain? They've maybe Googled it or seen a physical therapist that tell them, roll out your IT band. I'm like, the IT band's a tendon. It's not supposed to be rolled out. It hurts like hell every time you roll it out because there's no trigger points that happen there. You have built up fascia so you could feel like this vibration and maybe get a sense of relief of that outside knee.
Mm-hmm.
But if you go squat again and your glute med is the primary driver again, like you said, locking out the pelvis and external rotation, every single force is going to go right back into it. So your IT band is going to keep staying tight there. But it's like it's a band. It's a tendon. You don't want to stretch that out.
Yeah.
It's supposed to be
You don't
stable.
want laxity in there.
No, you want it to be stable.
So the funny thing is, it's like people had that discussion argument still, like, oh, you can't roll out an IT band because it's not.
Or stretch it.
And I was like, well, why does it work then? It's because your fucking quads are so overdeveloped and gummed up. You're probably digging that out.
Right.
You're probably hitting the quad.
You have narrowed it down to calling it outside quad.
Yeah.
Which is lateral quad for the nerds. And it's like, that's perfect way to put it. If your lateral quad is strong and your inside quad isn't, that's where the imbalance is at.
Yep.
Then you go for a run. So we see a lot of our CrossFitters and a lot of our runners too that maybe do some weight training on their own. Their glute med, same thing. If it's running and you can't internally rotate your hip and get your glute max to propel you forward on a run, then the outside of your knee is going to hurt. Right? I mean, your outside of your knees, same thing, is going to take that whole force as you try to go up a hill or go down a hill. And it's like knee tendonitis, whatever you want to label it as, it's still an imbalance of your glute and your quads.
And here, going back to the knees out topic, right? What kills me right now is there's a huge popularity in the bands around the knees.
Yep.
We used to do a lot of mini band side steps from CrossFit football.
Yeah.
Before.
And now there's the hip thrust is a popular one in the gym.
Before all the glute stuff and hip circles and stuff are popular now.
Yeah.
But we did a lot of that prior to learning it from CrossFit football. And again, I get where they're coming from. You want your glute med to be stronger because a lot of times when people squat, their knees cave in, especially on the reverse coming up. And if the knees comes in, it must be a hip issue.
Yeah.
That's what they think. But here's where that's not what's causing it. You can only go into external rotation at a certain range. And then once they do that butt wink, that's where everything kind of shuts off. And then when it shuts off, everything collapses inward. So you don't want to add and build more external rotators to become stronger.
And feed the imbalance.
And that's what everyone's doing. And then they expect that to fix the shift at the bottom or the knees caving in at the bottom.
So let me ask you this. Do you think that the people that present with inside knee pain from squatting are only people that have developed such a dominant outside lateral quad that they're at a heavy enough weight for that imbalance to stop carrying them up on the squat? So now like that valgus force is transferring into the inside of their knee. Only the higher level or heavier weights are doing it.
It could be, but it doesn't have to. It depends on the imbalance per individual. So this is a little like a bigger question or whatever that I have to go into. It's like when someone has inside knee pain, like we talked about, it's not as typical because you're overusing the outside quad.
Right.
But it's inside knee pain, then I have to figure out what's causing it.
A valgus force from the hip.
Yeah, so it might be like, okay, if they're squatting and then since they have no, glutes lowering, no inside hammy, and then the pain or the wear and tear is happening on the way down, or is it because they're bouncing out of the bottom coming up?
Bouncing out of the bottom, yeah.
Or are they running with, it depends on what's causing.
Because that's when you would see knees cave in, right? When they bounce out of the squat.
And if you look at the Olympic lifters, right, the hook grip videos are great because they're slow-mo.
Yeah.
When you get to the bottom of the squat, your knees push in because they're activating, it's not a collapse in, right? They're activating muscles because they're lifting heavy-ass weight. They're going into their inside hammy, their VMO, and that's what takes them up.
Yeah. Because
they're at such a deep flex in their knee at the bottom that they have to use their knees, the knee joint, the muscles around it, to propel them upward.
Yeah.
Pushing out, which was Kelly Starrett's idea and a lot of people's idea, like knees out in a squat, is wrong because you'll never see someone catch a clean or a snatch at the bottom with knees out because
Right.
their knees will shatter.
Right.
And find me a video. It'll never happen. So why is everyone teaching knees out in a squat? Because
mobility feels good. That's why you guys had such a good success with it. That's why manual therapy has such a good success rate, because you go in with a tight hip, you dig it out, and now you just went and did the same motion that you tried a week before with a tight hip, and now it's loose. Hey, now I did it. Now I got lower and I feel good. But over time, a tiny joint, like a hinge joint, for people that don't know, I mean, think of your shoulder. Your shoulder can go up, down, across you, sideways, external rotation, internal rotation, all over the place. That is a very complex joint, and that's why it's going to take 7 episodes to go over every movement we can think of for it. There's a ton of muscles attaching to it.
Just like shoulders and bench. We just do a whole episode.
We do a whole episode on all this stuff. Knee is literally flexion and extension, right?
It's so easy to fix.
Right. But, and how many muscles are actually controlling it? We're talking quad. We're going to talk a little bit about hamstring, a little bit about gastroc. But it's like, those aren't strong enough muscles to help you squat 400 pounds, right? So you have to look up the chain. It's that simple. You have to look up and it needs to be initiated from the hips and the core and lower abs and obliques and all that other stuff, right, that we're going to get into. But what people just lock into is, I have an outside knee pain, I need an outside knee fix. And it's like, there's no simple fix for something that's biomechanically imbalanced like that for so long.
There is, though, if you're looking at the right problem.
Right. So you got to shift your mind a little bit.
Immediate feedback,
Yeah.
Just like the same principle of rolling out your outside quads, your IT bands, and then all of a sudden you squat lower because you have more mobility.
That's a false sense of security, though.
Yeah, because things are turned off.
Right.
We have the same test and retest, but with movement in the application of what they're trying to do.
Yep.
So people will run and, I feel tightness in the first round of a 200-meter run. I kind of have a pain here, hot spot. Okay, well, try to don't hyperextend your knee, and then keep your glute flexed and your obliques on, and then it goes away right away.
I see that all the time.
That's immediate feedback that it's working within the pattern that you're using.
Yeah.
So it's not okay, stop, roll out your outside quad, do some of these hips or whatever, side steps, and then when you go run, that same imbalance is going to be there because you didn't fix anything.
And that's how it goes for me too. If I have I love to relate it to a teenage athlete, because they're with high school level coaches that are not showing technique sometimes, or I should say a lot of the time, and they'll go, I have a knee pain or whatever, and I'll be like, do a bodyweight squat, no shoes, in my office. This is quick. Squat down, and I say hold it at the bottom, and then I could bring a parent around and go, look at that right knee right now. The knee that's causing all this pain, made you pay all this money to come here and take time out of your day, and look at it. It's pointing outside, you know what I mean? I'm like, look at the left knee. It's unhinging backwards. It's completely pointing forward. And I'm like, look at the right one. It's got a lazy eye. It's pointing. It's like, what direction are you looking at, right?
And you know what kills me is that, okay, so you're saying this kid is doing a bodyweight squat.
Bodyweight squat. No weight.
Let's say left knee's pointed straight.
Yeah.
Right knee's pointed
it's flaring out.
Way out.
Yeah.
And I guarantee you, if he Googled it, if he YouTubed it, they would have him do a lot of the knee that's actually probably functioning better in that hip, the one that's pointed forward. They're going to have him work on that because it's not pressed out as far as the other one.
Right.
Isn't that crazy?
The right one, just turn it in more maybe next time, right?
Yeah, but it's usually they're do more outside knee, hip stuff for that left knee and left hip that might be functioning already better.
So this simple, and I'll ask the kid, you have pain right now? He's like, yep, point to it. Same spot as what he walked in with or she walked in with. I'll say, okay, stand back up. Drive the knuckle of your big toe as hard as you can into the ground. Do you feel in there yep? Some kids will be like my foot's cramping kind of thing, right? Before they even squat. And I'm like, do you feel it in your foot? And they're like, yeah, it's cramping. I'm like, perfect. Now sit back, but don't let that big toe come off the ground. Like a joint cue, of course, but it's more
there's a purpose though.
It's a purpose to watch them hinge back now, and I go, now hold at the bottom, and they're not even halfway down.
Yeah.
Right? They're at 90 degrees versus ass to grass in the first one. And the parent's like, oh, now I see both knees are facing forward. And I go, do you have any pain? No. And then I go, squeeze your glutes to come up. And they squeeze their butt together and rise up like vertically, up and down with their chest up. And they're like, I'm like, do 2 more like that, but slow. And they do it. And I'm like, do you have any knee pain on that? And they're like, no. I'm like, I did no treatment. And I didn't. I know I give you a little bit of a joint cue by driving in that big toe, but here's why. And then I go into the education part after that.
Because they're moving improperly.
Right. I'm like, all I did was just change the way you move, because now I got your inside quad to fire. Now I got your glute to fire when you got out of the bottom of the squat. Your knee pain's gone. Isn't that amazing? I'm like, and there's no body weight. Or I mean, there's no weight on your back yet. This is just body weight. So now just think that if you got this tendonitis to calm down, it's not a knee issue. It's not a technique thing. It's what muscles are driving you in and out of that squat, and they're not looking at it.
There's 2 things. One's like a false test, right?
Right.
And I'm going to talk about that. But the other one is, well, let's get into the false test first before I lose the train of thought on that. It's like if you were to do that test, like you said, hold the body weight squat, but
right.
They weren't doing that with the right mechanics, you could find a whole host of things wrong.
Right.
So then they kept squatting like that, go lower, let's test your mobility. Then all of a sudden their toes come up. Oh, you have dorsiflexion issue.
Weak ankles, high arches,
oh man, you
flat
have,
arches, whatever you want.
Overdeveloped like muscles in the outside of your shins and everything. Your lower back's starting to hurt because you're going lower. So you just labeled probably 10 different issues that because the assessment was like a false reading.
Yep.
When they actually do a proper squat, not pushing their knees out, using their obliques or anchor, whatever, then you can actually start to narrow things down. And this is where I always say it becomes super easy. Because once you start doing the right squat, it'll probably fix all your chronic issues.
Exactly.
Because the movement is what's causing these chronic issues.
And here's the thing is I'll take that kid and go, we're working on this hip now. Because the right SI joint on that right knee, super locked up. This glute med on the side's overfiring. Let's dig it out. And then just go home and I'll give them, like, if it's a super young kid and I don't want them squatting, like with barbells or anything yet, I'll tell them to do a either the body weight squat again or a wall sit, because they know wall sits from like PE and stuff. And I'm like, at the bottom, squeeze your glutes, come up, whatever. And they'll come back and now my low back is tight. And then I'm like, well, we'll just keep working on the hip and lower back. And then like about a month in, I'll look at the parent and go like, remember the knee pain we started with? Like, what happened? You know, it's gone.
It had nothing to do with the knee in the first place.
Exactly.
That's why plantar, ankle, arch issues, shin splints, knee, whether it's front, back, side, you know, behind the knee, it's not the knee issue. It's where the pain is manifested, where the injuries are happening because of the wear and tear. But you can't expect that the muscle around the knee to do all the work when you have all these core and hip muscles that you're not using.
Exactly. And so
it doesn't make any sense to do more
referred pain.
drills.
It's referred pain from having a tight hip. It dips down into the outside knee because it's very rare to have a lateral meniscus injury. So if you went
it's
to
so
like,
strong.
Well,
or overdeveloped?
No, because of the way that your hip moves. It doesn't matter if you have what shape your pelvis is in. There's different shapes of your pelvis. It won't bow out enough.
It would valgus in or whatever.
It valguses in to the inside of the knee.
That makes sense.
That's why it's called like the unhappy triad when someone tears their ACL, PCL, or ACL, MCL, and medial meniscus, right? Why is it all inside in a trauma, right? Like a lateral meniscus tear, I've only seen like one, and it was like a car accident, because it's just not, our body doesn't transfer force to the outside of the knee enough to tear something on the outside of the knee. Right? So like I told you recently, I tore my LCL in wrestling. Some guy dove in inside on my knee.
That's a whole different...
Popped it on the LCL.
Yeah.
And it's like, if I went and got an MRI and they're like, yeah, your LCL's gone, they'd be like, cool. Like, your meniscus is fine because you can't tear that on that kind of a mechanism. And they're just like, you don't even need that LCL.
Yeah.
You know, it's like, if you're going to play soccer and do a bunch of cutting on the outside of that knee, maybe, but it's like you're just going to aggravate the meniscus, but it's not going to tear. So they're not even worried about it. But I wanted to transfer into, like, why do you think the inside of the knee, obviously, what I'm talking about, like the transfer of the force to the inside of the knee is more common for our bodies, but that VMO, I want you to get into why that VMO is so damn weak on everybody. It looks visibly big on a lot of people. If you look down at their VMOs, you're like, That's,
a
it's
cyclist, soccer player, a runner.
Soccer players in particular with that hyperextension over and over their knee.
ACL tears?
Why is the VMO so strong? Well, I'll get into ACL tears later, but why is the VMO so strong, but then we put them into a squat at 90 degrees and the VMO shuts off?
It's a good question, and the answer to that, in my opinion, is that that VMO's inside quad is overused, not functionally.
Perfect. Yep.
It's because it's overused for the last ditch resort. When people run, a lot of runners will have a big VMO or cyclists or whatever, but every time they step and their knee collapses inward, all of that force of that 180 pounds, like for me, if I didn't fire any other muscle, that whole analogy again, all 180 pounds of my body weight is going into the inside of my knee. That's supporting it every step. That's where you get a flat foot because everything dives inward. So that VMO is working, but that's where the imbalances causes the injuries, because how big can that VMO get by itself until it snaps? Without the inside hamstring, without the glute, without the inside calf, whatever you call it, all working together. So when you get into a squat, they're just relying on they bounce out of the hole or something. They rely on their knees caving in to come out, which you'll see some of the pros do. But if I don't have any of my other muscles trained, then it's just they have to push out to feel some sort of hip stability, because they don't want to dump it into your lower back.
Or get a hip pinch.
Because why it shuts off in a squat is because once they put the bar there and they start loading their hip first, because they were taught hips back and down or some shit, and then obviously when your hips go back first, it's not even a knee loading issue right now. Then it's outside quad, erectors, and then by the time all of those things are on, those things aren't going to just magically shut off under load during the lift and then use your VMO all of a sudden.
The VMO extends your knee, right? That's the primary mover of your knee, to extend, which is like a kicking motion. It's the strongest muscle on your leg. So if you were deadlifting, and this is a big thing that we found when we're getting people to get into full knee flexion on their deadlift, and this is the only cue I gave myself on my recent PR on my dead, was driving my big toe into the ground until my VMO turned on, and that's all I really gave a shit about. And then just driving off that floor, going into maximal knee extension, and then everything else in my chain already kicked on, right? Like, I was like, I know my lats and my glutes and my hamstrings are going to be strong enough to pull this bar, but why is everything dipping into my grip and into my calf, let's say? Because the VMO I never targeted that before. But getting that little teardrop muscle, it's like right above your kneecap on the inside, that VMO is so key, and we found it weak on so many good athletes.
It's not even just for knee extension, it's like the loading of the knee too.
Right.
For movement. So it's that whole, like, what's the action of it, right? Versus the actual function for movement.
Right.
So when you're taking a step, when you're going upstairs, when you're loading a barbell, when you're running, your knee has to bend.
Yep.
Weight has to be transferred somewhere around the knee because it's bending, and it should be going into the inside knee. So it's not just extending.
And our recent love for freaking front squats, too. Like, driving knees forward. I mean, that's one of the rare joint cues we'll do.
I've had so much discussion with other CrossFitters, even coaches or whatever.
Yeah.
And even PTs on the Instagram having little nice debates, which are pretty much arguments. But everyone still sees what the top lifters are doing, but they're not really seeing it. They're seeing it through the cues that they've learned in seminars.
Right.
So when people are loading this dip and drive for a jerk, they still think it's external rotation and torque and all that stuff.
Right.
And if you look at them, look at CJ Cummings. They just posted hook grip. He's the 4-time junior champ, all that shit.
Stud.
You'll see that their knees are tracking their toes, so their toes are aimed out a little
bit.
So their knees are tracking the toe,
which is natural for your hip, by the way.
So so don't have your toes perfectly straight, because that was another debate.
They'll actually internally rotate your hip.
Have your toes aimed out, and you watch the top lifters. When they bend like at the knee to load their VMO.
Yep.
Because if you think the mechanics of a lift, an Olympic lift, whether it's the jerk portion or a clean or a snatch from, they're pushing as hard as they can, not with their hip so much. Because if you look at the Olympic lift, it's a violent knee extension, what you just talked about.
Yep.
And guess what muscle does that? Not pushing your external rotators. It's impossible. We've done years of that because we thought it was right, because
Mm-hmm.
it looks like their knees are out. So we'd hold the jerk, we're about to go, or for a push press, we push our knees out as hard as we can. And then every time in a slow-mo video, you'll see that on the way up, you shift forward and knees collapse in. Or it dumps forward.
Yep.
But if you're trying to elevate this barbell up, and you watch all the Olympic lifts slow-mo, it's a violent knee extension.
Yep.
Their hips are coming along for the ride too, but that's the VMO that does that.
And before you get into applying the VMO on something like that, most Olympic lifters are doing front squats, right?
And they're being taught knees out. They're being taught knees out in the dip and drive for the jerk. They're taught knees out in every fucking thing.
But when we broke down the FixFit mechanics of a front squat recently, I was like, how is that helping my deadlift? How is that helping my left knee pain now? And I just really started thinking about that because I was like, it's all because of that VMO. It's just something that when I front squat, I'd always hurt my hips. Like I'd think the same thing. My hips are just too tight. My hips are so tight. Did I stretch my psoas? No. Like I was like, what do I need to do? More time under tension under the bar? Will that help me get some better mobility? That's what I always thought. No, recently it was the VMO. Driving my knees forward, just like you're talking about, but loading it more with heavy weight and coming out of that front squat, I was like, I'm front squatting more than ever. My knees feel better. And then overall my power is going up because I'm training in that plane. More than a back squat for me personally.
That's a great point because someone in our gym, Amanda, she's done CrossFit before and she came to us a little later, and this was what she said when I was going over in one of our classes saying, here's the mechanics of a high bar back squat and front squat. Those are similar types of squats.
We're gonna have a whole episode on that.
And then look like a regular back squat.
Yeah.
So when she figured that out, she'd always struggle and have her butt shoot up on her front squat. It would never be heavy enough. She'd always dump it. Her knees would hurt. Her back would hurt. But the reason is, she said this, and I use her quote now, she was back squatting her front squat. She was using like a back squat mechanic for the front squat. So what that means, to simplify it, is she was thinking hip-led movement, like a back squat, hips back and down, right?
Right.
If you want to stay upright, like a high bar back squat, a front squat, a thruster, a clean, a snatch, you have to stay upright. And the only way you can do that is if your knee is the primary driver.
Yep.
To load the force.
Yep.
And then if you're trying to go knees out, you can't. So you have to go, I'm not calling it knees in, but you have to load the VMOs to take you all the way down. And that's what keeps you upright.
Yeah.
And so everyone that thinks one type of squat, back squat, hips back and down, push your knees out, it's impossible to do a proper front squat that way.
Yep.
Mechanically sound. And then now you have a whole host of issues again because your knee hurts and then your elbows drop, and it must be lat mobility because your front rack sucks.
That's what fixed it for me, really. I mean, it wasn't like I just did a different cue where I initiated with my knees. That fixed me. It was more of the understanding of, like you just said, I was doing a back squat on my front squat.
Yep.
Initiating my movement with my butt back first.
Yep.
That did nothing. And I thought I was unhinging my knees, which I was. And I was like, that's great. I'm loading my glutes, my hamstrings. I'm using my glutes and hamstrings to drive me up. But I was losing that tension on the way down. So then everything had to go dip into my hip.
Yeah. Then your hip pain. You get hip impingement.
Always a hip impingement every time. Yeah. And then now I drive my knees forward first and then sit back. Not only do my hips feel better, but like my VMOs cramp, my chest cramps. Like there's a whole argument we can do on a front squat versus back squat episode about the upper body. There's a lot of an upper body movement with your front squat.
But we can't even get into that because it'd be a false reading if you don't get the first part down.
Absolutely. So I'm glad we're going. I mean,
in this sequence,
it's no accident that we're going in the order of headaches, because that's what brings you in. Shoulder pain, that's what everybody sees. Knee pain, these are so common that we have to see those first before we can get into something of how a front squat can help your pecs and your lats.
Yeah.
And your overhead lifts, it's like, or your cleans and clean and jerk actions. Like, we can't go into that yet.
The Chinese lifters will tell you when they do a back squat or any movement, it's all the same to them because they're trained for one thing, bar oscillation. How do you move that bar up and down with your legs? So when they unrack the bar and you go to YouTube, watch a lot of their seminars, they're like, keep your knees soft, but be ready to have the quads or the legs absorb all the weight.
which is awesome.
So then when they oscillate the bar for a jerk, when they're just driving up and down, their knees become springs, not their hips.
Right.
Because if you push your hips back, the bar goes forward and it fucks everything up.
Fucking femur will bow, and it's not going to take anything.
And it doesn't. So it's just like they're saying the same thing. It's just not the way we're trying to interpret it with the muscles and the chains and the mechanics.
This is where powerlifters get Snap City, dude. Their femurs bow so much that way that eventually that knee's gonna fracture.
They're at such extreme weights.
At extreme weight, yeah, extreme.
So it reminds me too of the why the VMO, the question, turns off on a squat, or why athletes have it overdeveloped. It's funny because a lot of athletes are being taught all these strength and conditioning programs to do a lot of outside glute work, side step shuffles, the monster walks with the bands around their ankles, around their knees.
Yep.
All of that's focused at pushing outward.
Yep.
How does that make any sense? And yet they have still the highest rate of tears, ACL tears in soccer, because it's not the outside glute or outside quad issue. The reason I say that is because when we're talking about athleticism and function, think of any sport. When you learn from like football positions, you're in a power position, like a ready position. You're in the ball of your foot, the big toe joint. Your knees are in line with your instep, pointed in a little, hips back, like you're ready to tackle someone or take a tackle. And then everything's anchored inward to your VMO. Mm-hmm. When you cut and push off, it's inside quad, VMO, glute, all of that stuff. At no point are you pushing outward.
Yep.
If you were to have hold a knees out type of position, which you're training these athletes for that position, you could push them over in a second.
Here's my...
You don't use it for sport. You don't use it for movement.
I'm so glad you brought that up again, because I was going to say, let's go over an overdeveloped VMO. And the classic overdeveloped VMO we see, soccer players. Why do adolescent females whose hips are naturally externally rotated and the valgus force is high, they have
the Q angle,
plenty of studies to talk about the Q angle, but why does this keep happening? Because they hyperextend their knee. All soccer players say, I'm dominant in both feet. They don't want to be 1 foot dominant.
They're running hyperextended,
kicking hyperextended, and that's it their whole life, because you could start soccer at 4, 5, and you just play it till you're 16 on imbalance without weight training. Overdeveloped VMO. Now you're hyperextending that knee over and over. Where's that posterior chain, if you want to call it that? Inside hamstring's not there, glutes are not there, core is weak, and that's why they're prone to that ACL tear for the reasons you went over.
You're accelerating it.
Here's another soccer injury real quick, just to kind of cover it, because there's not much. There is some treatment we could do for it, but the quad has a tendon that attaches to the kneecap that goes to the front of your tibia.
Is that Osgood-Schlatter's
Osgood-Schlatter's, yep, and some basketball players will get this too.
Yep.
Same thing, running, dominant quads, jumping, dominant quads, no glute, no hamstring. And that tendon is so inflamed that it's starting to rip off the tibia bone, and they get a lot of kids will get early detection and just be told to rest. And it's go ahead and rest. If it's completely torn off the bone causing a fracture and they sit out a season and then it fuses, makes this weird little knob on it. So we see adults with that all the time. And it doesn't really cause long-term damage from what I've seen with my patients.
Other than imbalance.
Other than you just keep feeding the imbalance for sure. But what I was going to get into is that front knee pain is what I'll see in the early stage. And I have to rule out Osgood-Schlatter's, right? And I check the patellar tendon and I'm like, it's inflamed right now. And we could do Graston on it. We could do the hypervolt massage on the quad and release the VMO, adjust the hip, and they feel great. And I do advise rest for them. I mean, it's a tendonitis, and if you go, especially for a soccer player, keep hyperextending on that right knee that's inflamed at the patellar tendon, you're at high risk to cause the Osgood-Schlatter's next. And some kids are just disposed to get that injury. But that's a lot of the front knee pain I've seen is usually soccer, usually basketball. But the common denominator on both of them is I always go right next into, what about hamstring training, glute weight training? What are you guys doing for that? It's running stairs, sprints, and I'm oh, that's feeding your quad. It makes you faster, and it makes you more explosive to run stairs, run sprints, run lines in basketball, but they're not ever weight training in any capacity. If they're not weight training in any capacity, I show parents right away, you have to get their glutes and their external obliques to fire. Otherwise, it's just going to keep getting fed into that imbalance. And if they're high level, it's usually always the higher level kids that are getting that injury because they're being relied on more, right?
And then another injury that happens a lot that people just don't go see anyone about because it's not it's not like you're tearing ACL or meniscus, something serious, is hamstrings. They tear their hamstring or strain their hamstring, and it's because they aren't firing that within the chain again. And that's another issue, is that I think most people will start to reinforce their knee and try to get athletes faster, better, and they always talk about hamstring, right? But the problem is, if your glutes aren't firing with the hamstring,
the inside hamstring, go over that too.
Yeah, the inside hammy, because again, most people are pushing outward, right?
So they're outside their hamstring, maybe.
But in
easier
terms
to
of
fire.
athleticism, and when you're doing things like sprinting for sport and landing and jumping for any other jumping landing sport, running, it's that inside hamstring that is what you're supposed to use, right? And if you don't train that properly, and then you're going at max intensity because now you're faster, you're playing more, that hamstring's like one sprint away from a pop hammy.
You know what's killing me right now are
There's so many popped hammies all the time.
There's these Nordic curls that everybody's doing. Have you seen that? They're on their knees. Someone's holding like that. This is a popular one to do in high school, right? Because it's easy. Kids on his knees, friends behind them, putting all their body weight on their ankles so they could do that Nordic curl. So they're just they're eccentrically loading their hamstring while their head starts going towards the ground while they're keeping their body straight, and then they try to curl up with their hamstring. And it's like, sure, that could get your hamstring to lengthen and shorten, I guess, but like you're still not loading it in a chain, so that just isolating your hamstring like that is not gonna fucking be enough. And I can't emphasize that enough. Like people ask, like, can I just do the hamstring leg curl? I'm like, sure, yeah, do that to get it to fire, but you have to freaking squat. You have to move these muscles in a chain. Your hamstring is not the weak part of the chain, and you just have to feed that over and over.
So
that's like saying I'm going to do a bunch of bicep curls to fix my bicep tendonitis. It's like that's not what we're saying.
If you do a lot of hamstring drills because you were told to help with your knee issue, it won't do anything until you apply that drill to the movement you use.
Right.
So I'm trying to just say it so that people can like take home message, something simple, because they're like, oh, this drill has helped so many people or whatever. And it doesn't, because you're not training the body the way it's going to be used when you play soccer, when you do a back squat, when you do a clean, when you do a front, whatever. So is the Nordic curl and all these other hamstring GHD things good or bad?
GHD or good mornings.
Yeah, or RDLs or whatever. It's how you do the movement. What's the intent? If you get really strong at a Nordic curl, you can still blow out your ACL.
Absolutely.
It probably makes it worse because now you have a giant inside hammy, no glute, no oblique, no VMO, and then the hammy might pop, or something happens where you're sprinting so fast. You see what I'm saying?
I've told you so many times. My favorite,
stop that shit.
Favorite thing to do to an athlete, a high level athlete. We've had Olympic caliber athletes where I go, why is your lower back hurt so bad? Why does your knee hurt so bad? Let's do a single leg RDL, which they're supposedly doing in the gym with good mornings.
Bird picker, seesaw, right?
Bird picker, seesaws, whatever the hell you want to call them. Nordic curls. I do GHD. Let's do a single leg RDL. I've had professional athletes try to do it, and they're falling over. And I'm like, you're loading right now your inside hamstring as you kick back. You should be able to keep your obliques on as you hinge the whole time.
Not rotating their
Your
head.
knees should be relaxed like a spring. Yeah. This is body weight. And they're falling over, or they're shaking like hell because they're so athletic they could actually turn on that muscle on an instant cue, but they're shaking. And I'm like, is there any other workout you do where you shake that bad? Shaking to me is like neurologically the muscle not being able to fire.
Yeah.
That's my opinion. I don't know. I should probably look into that a lot more. But to me, it's like that inside hamstring on this guy doing a left-legged RDL is like shaking so bad because it's never been turned on in that plane before.
Yeah.
Which tells me that's a good thing because now you've identified it. Now you can do this. But don't add a bunch of weight to your hands with kettlebells and just think like I'm going through the motions with that. Because if we slow it down, you're shaking, or even worse, I've had big powerlifters in the past falling over. I'm like, you can't even do this on one leg. Why are you doing two of them on a good morning and thinking that you're accomplishing something? Because you're not.
It's weird. It's a weird mindset, and I have to talk a lot of athletes down because it's like they're always saying, well, how come most of these golfers do these exercises? And they're doing these deadlifts, they're doing these curls, or they're doing whatever. They're doing RDLs with kettlebells.
Yeah, always looking for the quick fix.
Exactly, but it doesn't make...
It's got to be labeled something. And
if you're a golfer and you're trying to go pro, or you are pro, whatever, like, you're not becoming a world champion RDL person.
Right.
So why keep adding more and more strain to it where you're not using the right mechanics? Because if you can't even do a damn bird picker or do one without any weights, what's the point?
That's right.
And if you're a soccer player, why are you doing all these side steps and all this weird shit if you're not applying it to your run mechanics, sprint mechanic, kick mechanics?
Yeah.
It doesn't make any sense.
Can you imagine if we took like one of these PTs that love fucking mobility so much, and I said, do a single leg RDL, and they do it super slow, and they go like, oh, look how flexible I am, and I'm out of pain because I have all this goddamn range of motion. But then I go, okay, great, your RDL looks awesome because you're a PT. Let's put a kettlebell in your right hand now, offset your fucking center of gravity, and now do it again. But also, don't move your foot this time. Keep that foot flat on the ground the whole time. Then they're fucking falling over. I'm like, see, now we're loading your SI joint. Now we're loading your glute and your hamstring, and you're falling over. And then, like, now you're going to start relying on that outside quad, outside knee, because you're losing the force from the ground up.
You wouldn't even need that because that's just a hinge pattern, right? I could just get someone to hinge, which is bending at their hip, standing on 2 feet.
Yeah.
And I don't care what background you have, they're probably going to be in a habit of pushing their hips to externally rotate.
Yeah. And you might not feel it on the knee right there.
No, because you're probably going to feel in your lower back.
But if you do it that pattern and I see how comfortably you're doing it, I'm going to assume that when you reach down to pick up your daughter off the ground, I'm thinking of someone in my mind particularly, pick you up your daughter off the ground, I can't do a jog on the treadmill for 1 mile without my outside knee or my SI joint hurting. Well, if you do that RDL that well, and you're not thinking about the intention of the muscles that you're firing while you're doing it, I'm going to assume that that's exactly what you're translating into real life.
Yeah.
And that's why it keeps happening over and over.
It's
overuse injury.
That's the thing is we talk a lot about sports and performance, right? But
right.
Most of the people we deal with are just like people that don't want knee pain.
Yep.
And I always tell people that this is movement. If you're walking up a flight of stairs, if you're walking in general, you need to be working on these drills and apply it to that, or else it doesn't matter because you're only in a gym for an hour maybe.
Yep.
And even in that hour, how much are you working on that seesaw or kickback?
Yep.
But when they go, to Costco to pick shit up, or they're picking up their kids, or they're bending up, it's like, where did all that training go?
Exactly. You're
not going to get better until you fix your movement pattern, because all day long you're just giving your body imbalances because you're moving the wrong way.
I think that's where the FixFit mentality comes circling right back. That we've been working on this shit for like 3 years, and it's a slow progression. And we're still identifying new. Like I just 2 months ago figured out this front squat thing. We've been talking about it for so long, but I'm like, I finally felt it myself, and now I'm like, okay, now I got to capitalize on that. But I also didn't just go, well, I did 5 sets of 10 of this, and it didn't work for me. I went back to the drawing board, went back to how I was feeling the next day. Constantly have to reevaluate, and day by day. In the middle of the workout, stop and think about it too. Like, what am I doing wrong right now? What do I need to feel? Right? And then go back and work on it. So it's a mentality focus. It's a different shift. It's a different intention of what you're trying to do. So that's what's hard for people with a knee injury. They just think that the standard quo thing is, I heard a pop in my knee on a box jump. I need to go to the doctor. The doctor needs to x-ray it and tell me everything's okay. I need to go to the physical therapist to do a structural evaluation that says nothing's torn yet, or that we can see with the naked eye and our structural test. But in 6 to 8 weeks we can tell with exercise if we need an MRI, right? That's the standard approach, but it's like you're just going through those, I gotta check A, B, C, D, versus like, let me go back to the drawing board and actually just stop and work on actually firing intent muscles that you and I are talking about, like these giant muscles like your VMO and your inside hammy that are
obliques
that nobody's ever touching. Try it. I mean, it's a different option, but we see dramatic results immediately with people because
instant.
It's not. We don't need time to know that. Everybody has it. Everybody has these imbalances.
So FixFit's not a program. It's a principle. It's a protocol.
Exactly.
So like you're constantly figuring what's wrong. Isn't that the goal?
Yes.
Wouldn't you want to know what's wrong? What's causing the pain? And I have an example. I'm using my buddy Ryan, and this is his story. I didn't even remember, but he keeps telling me about it. It's like he came in one day, like he got out of the car wrong or something, and he was hurting, like he couldn't even move. It was that bad. And then so he's thinking about quitting, like CrossFit or whatever. And then he came up to me and he said that, hey, like what knee brace should I get? Will it help? And I told him, I was like, that won't do a damn thing for you. And he's so like blown away, like what? What does that even mean? And I told him that's not going to fix the problem. It's probably going to give you a false sense of security to keep working out to make the problem worse.
Yep.
And I fucking hate knee sleeves. I used to have a bunch of knee sleeves because I've always had quote unquote bad knees because I played a lot of basketball. It just gives you a false sense of what you think that little knee sleeve is going to protect even like a jog with all that 180 pounds of my force every step.
Yeah.
And so what we did is, even though he had a knee issue, he kept working out at intensity because I had him do a lot of hinging and a lot of core work. He did so many fucking oblique things and
you'd hinge on somebody on a bad knee. Oh my god.
He was doing heavy deadlifts.
You're a rebel.
Without bending the knee because it's just soft. But he has that story, and the knee's been perfect since then.
What about walking with a sled behind you?
And so with
Nordic curling your hamstring when you walk with the sled. How come we see people come back and go, my glutes are on fire, all my knee pain's gone? We've had people get knee pain go away from pushing a sled.
Because when people have knee pain, a lot of it's from running, right? Most people that your chiros, massage therapists, trainers will just know that running wrecks people.
Yeah.
And so instead of just saying ice it and stop and don't run or don't walk and do weird drills for your knees,
right?
I get them to start walking right away with the sled because it's an intentional walk. They're bracing their obliques, they're firing their glutes, they're pushing or pulling a sled, doesn't even matter, but they're firing their VMO with their inside hand knee, with their inside calf, pushing through the big toe joint, and that's the immediate feedback. Right. So let's say, because I'm here as a trainer, that's my scope. They come in, I'm looking for a way for them to get this running cardio pattern up, movement pattern of running or walking. Oh, my knee hurts. I get them on a sled, fire all the right muscles. Oh, my knee doesn't hurt, it's weird. Okay, great.
Mind blown.
I'm here to train you on running or walking or whatever it is, and then now you feel great, so go do it.
Did you change your run mechanics at all? No. You turned on big muscles to shut up.
Yeah.
Temporarily.
Yeah.
To shut off little muscles, like the ones that are attaching to your Achilles tendon that cause heel pain, or the gastroc that's attached to the back of the knee that causes popliteus pain. So what I want people to figure out and distinguish from this podcast especially is that if you did something like a Nordic curl for your hamstring, you are activating a giant hamstring. So maybe it does make your lower back feel better. Maybe it does make your knee feel a little bit stronger. But until you apply the full body mechanics after that, if you don't apply that hamstring movement that you just did to something bigger, then you're not really fixing the structural problem, right? So what we're saying is, we don't want you to. Notice we've not given out one exercise of like, hey, to start you should just do this, this, and this, and then get back to us.
We don't know what's wrong with you,
right?
We don't know what's causing your. Because I have examples all day. Like Weishin, a lot of people are doing half marathon training.
Yeah.
There's like at least maybe like 8 or 9 of them or something, and then since there's a lot of running, a lot of them have knee pain, hamstring issues, and we've been doing a lot of glute sled walks. And then just from that drill, a lot of them said, oh my gosh, my knees never felt better. I'm running faster, less injuries.
Yeah, so are they like, should we just do that every day until the training's done?
And sometimes it's that simple for them.
Yeah.
And maybe it's all the other drills they do in class too.
Yeah.
But we don't know. We just know that if it's working, it can be as simple as that for them. But it's not an end-all, be-all. Like, that's the protocol.
Hey, the mindset's working.
All the runners have to do the sled glute push. Or maybe it's pistons that work. Maybe it's oblique openers.
That's why we're not telling people to sign up for if you're a runner out there, if you're a runner out there, sign up for the running protocol where you're just going to do sled walks a bunch of times. And guess what? All your knee pain's gone. Like, no, it's a mindset. It identified one small chain.
And here you go. This is why recovery protocols don't work.
Yes.
I'll put it out there because I've seen it time and time again. if you have knee issues, and from my experience, if you follow some sort of knee protocol, whoever the fuck you got it from, whatever you purchased or whoever you went to see, it won't work.
Yeah.
Why? Because all the examples we did, you could do all these stability drills and all these things for your knees, and then the first thing to go away is pain.
Yep.
The last thing to go away is your movement imbalances.
Yep.
Right?
Yep.
So you can follow this packet of fucking exercises to fix your knee, and you might be the fucking world champion at these exercises now because you're so good at doing them. But then you go do something that's what you're going to need to do, hiking with your friends. Go back to CrossFit, go back to the lifting, go back to squatting, running. You haven't changed any of that.
Yep.
And you can't change it by doing isolated drills. You can't do, let's say, a pec fly on a machine and then go bench, and your bench will get better.
Yeah, exactly.
Your shoulder will still fucking
But that's
hurt.
what's programmed for a lot.
And same with running, right? You can do all the run drills, stand on a fucking ball and do all these weird drills, and then when you go for a run, your knee's going to be fucked again. So for recovery, those things don't work. And there's no such thing as a protocol that just guarantees you to, like, you do these 10 exercises, and then now your knee's better. Your pain is better.
Yeah.
Because you rested from doing what you were doing. You're probably not squatting anymore. You're probably not running anymore. That's why your knee feels better.
Yeah, the swelling went down.
Don't get it twisted that you fixed fucking anything. And sometimes it's like because they have these drills that got their glutes a little stronger, and it may have worked accidentally. But when you want to know exactly what happened, not like by chance I did these.
Yeah.
Now I feel good. So it worked for me.
Yep.
It might have worked again, but did you understand what you fixed or what caused the problem?
Nope.
No way.
That's what we try to.
No way.
I feel like that was the theme of the episode, was try to figure out where it's coming from, and if you don't know, ask. Right? And like we were saying earlier, like we know, like if you come to us and say like the outside of my knee hurts when I squat, like something very specific, that means we know that you were like, and then if you follow it up with like, I've been doing pistons, but the outside of my knee still hurts at the bottom of a squat, I'm like, that's so specific. Yes, I will work with you. But if you just come up to me and go, my right knee hurts, can you fix it? Or you know what? I think I heard a pop in my left knee. I think I gotta stop. And it's like, that's where we drop our shoulders and go like, oh my gosh, like you guys aren't getting it.
Yeah.
So it's like, to wrap up the episode, or to sum it up, I guess, if your mechanism of injury is I popped it and it's swollen, if you feel like you have to go to urgent care first and it's a $10 copay to get an x-ray and some anti-inflammatories, fine. But after that, get it assessed by a sports professional. I've had even patients come back from their quote-unquote sports doctor that's still like, yeah, he took it through the range of motion, everything was fine, and he referred me to PT. Because he's like, and I'll give you a cortisone shot to speed up this process. And it's like, that's their only option. Like, it's not surgically something that needs to get repaired, so that's the route that you should go. But if you're looking for more, I want to stay on top of things, I want to keep moving, right? And I don't want to stop going to the gym, then that's where you need to talk to somebody like a trainer that knows what the hell they're talking about. You could come see me if you want a second opinion on structural analysis. If you want to talk to, really good physical therapist that is sports trained too. I always say sports trained, meaning like, don't go to Sharp and be like, get taken through the freaking stretches for your knee, because there is no stretches, so there is no formal landscape.
I always get people to go because they want that peace of mind, and I want them, and it's not my scope. Go get MRI, get X-rays, get everything.
Get things ruled out.
When they are cleared to move, I always tell them, you could come talk to me, because that's when I'll do it. The one thing that I have a problem with, not because of, I have a problem with cortisone shots, because it's hard for me to work with someone just in that scope, right? So like if you come to me with knee pain and you're going to get a cortisone shot, I can't work with you effectively. I'm not telling you not to get a cortisone shot. I'm just saying if you're going to come to me and you want my help for movement, I can't work with you.
Right.
The reason is the pain is your body's natural signal to tell your ass that you're moving fucked up.
Yep.
So if you mask that and then you're doing all of these drills that I need to do for assessments and you don't feel any pain, I'm going to give you, it's a false reading. So if you get a cortisone shot, I just can't work with you for that duration while it's lasted. But a lot of people that in my gym have got cortisone shots, they'll get more and more and more, and then the duration of it working is less and less and less.
Yeah, we can get into that another time too.
But just, things like that, it's like you can get it checked out. But to simplify it, that's the one thing I wanted to go over. It's having that fixed mentality, because it might be as easy if something is flared up, if you change or think about changing the way you're moving the body. Because if you're going for a jog and you've been jogging all week or for a whole year and everything's fine, or doing air squats, and now all of a sudden your knee starts to flare up.
Yep.
Well, it's your body starting to break down, and then maybe if you change the way you move a little and then the pain's gone immediately, then that's all you need to do.
Yep.
It's not that complicated.
Exactly.
If you look at all the videos I've posted about how things work, all the podcasts that we've done, it's like fire your obliques, the big part of your glute, your inside quad, your inside hammy. And that's pretty much everything you need for your lower body, your knee, your back. It's like, have you tried doing that in a clean? Have you tried doing that in a squat, a run? And if you just did that a little bit.
And if you're confused on the principles, this is what the podcast is for, to elaborate. But also, if you need to know for yourself specifically, Mark and I are available one-on-one. I mean, I just talked to someone recently, and I was like, Mark's helping people virtually. You can send him a visual picture or a video of your body weight squat, and he can send you some stuff back. But you have to understand the principles in order to be able to, if I work with you, if you work on whatever, if you're paying me for an assessment because you just want it or you want more in depth, like, I spend a lot of time on that, especially that first assignment. I always book up like 2 hours. Like I say it's 1 hour, but we always go like an hour and a half, because it's so in depth for me to do that assessment on that front. It's like if you come in, you're like, oh, my knee hurts. I have to go through all these movement patterns and see what you do at work, what you do for your sport, how you're sitting, how you're squatting, how you're, like, everything. It takes a long time, but I'm able to do that. But then 90% of the people out there can just do a couple piston drills or that sled push walk, and they're able to sustain marathon training. I know.
That's it.
I know.
And it doesn't have to be like, come see me or come see you. We can, and I could break it all down, so that's an investment in your time or whatever and resources to do that. But from what we've seen, it's a lot of people like, oh, my back hurts or my knee hurts on a deadlift. It's like, you flexed your glute. One thing you did bring up I want to talk about is the VMO in the deadlift. So I went over a seminar and I had a couple debates with PT people trying to teach deadlifts.
Yeah.
Back flat, hips this high at a 45. If you are deadlifting and your hips are too high, you're only relying on your lower back and posterior chain to do the lift. It's almost like a good morning.
Yeah.
Yeah, your shoulders are at 45, or your back's at 45, so it looks like you're in good position. But you need to get your hips down. The first part of it, when the bar is at mid-shin, for you to approach it and be mechanically sound, you have to use your VMOs to elevate that bar to above the knee, because your knee is in that deep bend or flexion, whatever you like to call it. So if you argue that it's all a posterior chain type of thing, it's hamstring glute, yes, but that VMO better be firing with it. If not, that first part of your deadlift probably looks like shit. Your hip shoots up fast, and then it becomes an ugly-ass low back bend. Everyone does that at heavyweight. Yep. You can get away with that, like, more so CrossFit deadlift, where your hips are higher. You take the VMO completely out of the equation because it just looks like a fucking kettlebell swing. Yeah. But if you're actually going to be efficient at deadlifting and you don't want to blow your back out, it's the same fucking chain of muscles we're talking about. Your VMO has to be engaged.
I can attest to that because I get a lot of hamstring recruitment, and I also don't get lower back pain. I think my obliques are fine. It's my left VMO is what I've had to work on, because in a heavy dead where I'm focusing on getting everything to fire because it's a 1 rep max or something, right?
Yep.
The back of my hamstring or the back of my knee hurts, which we've identified is almost probably calf. I haven't properly got it assessed like by a manual therapist to actually dig in there, but just on personal assessment, because the reason that I think that it goes away is that after that max out dead, I'm doing something that's firing my glute after. I'm doing something that's firing my VMO after to cool down or whatever, and then the knee pain goes away. So it's like I'm violently hyperextending that knee so much that it's putting pressure on the back of my knee, but it's like it's just causing strain, right? And it's like if I overload the quad afterwards, the VMO with like something like a piston, something like I do that deep lunge piston now to get the VMO and glue on at the same time, knee pain's gone. Yeah. So it's like it's such an important part of the chain, because it can even cause back, like for me, like my butt's high, I'm activating a lot of hamstrings. So for somebody that could assess it from another eye, could go, well, your hamstring's on. That's good.
Yeah, that's it.
You know, no lower back pain on that? Like, because people, we've gone over that before in another episode. People come up to me and another member that go like, damn, your legs look like a straight-legged deadlift when you deadlift. And it's like, that's got to be bad on your lower back. It's like, no, it's not. It's actually just bad on the back of my left knee, which is I'll take that problem any day if I could turn it off with a cool down exercise.
Yeah.
You know?
But that's your imbalance. The VMO is not
It's a huge portion. Yeah.
And after, again, it's like that false reading, right?
Right.
If that first part of the pull is off, everything else is going to be fucked up. So I could point out 15 different things. Oh, your hips are too high, or your back's so round. But it all started with that VMO not supporting that first part of that knee extension.
Right.
So
totally.
That's where I got that cue from Eddie Hall. Like, he's the only guy that's ever pulled 500 kg. So if you complain,
he literally drives the earth away from him.
He says that he views it as like a leg press.
Yeah.
And everyone's so keen on, it's posterior chain, it's posterior.
You know,
yes, but first part of the pull is a leg press. It's a knee extension.
That's why he's, the world's best at that, right? Because I'm like, I feel like I'm trying to sit down as low as him. I'm trying to make it a leg press, and I just don't feel it.
It's because your VMO doesn't work. You know,
exactly.
It's like, what's the cause and effect, or
it's
what's
also why I'm at
why?
400 pounds, not 400 kgs.
But I think that's a huge issue.
It's a big difference.
Trying to fix and move forward with this stuff is that,
yeah.
like, again, we're constantly testing. We're constantly testing different movement patterns for the knee.
Right.
A lot of runners, a lot of deadlifters, a lot of golfers, whatever. And that's where the gap is. Okay.
Yeah.
This is what we want to share the knowledge. Feel free to use it, whatever, if it works, great. But it's because the people that are looking for help are looking for pain management, and the people that they're seeing probably haven't done as much deadlift research as I have with all the members that I have, and seen the increase in progress.
That's a good point.
So go ahead and do your knee rehab, but if you love deadlifting, you might want to go to someone that's testing the deadlift for the knee.
Oh man, knee rehab. I don't even know how. If you ask what that entails, a lot of stretching, a lot of foam rolling,
and this is another pet peeve
clamshells. Clamshells and what else?
If your knee's worn down so much, because it has.
Yeah.
And I don't disagree, because people are in pain, and I have a lot of members that have had knee issues or whatever, knee replacements, the whole deal, surgeries, which I get, because you don't want to be in pain. But whether you get surgery or not, I'm not telling you not to, you might want to change your movement pattern regardless, because you still have to walk, hike, sit down, get up, which is a squat, the rest of your life.
You mean surgery to clean it out won't help? Clean up all the debris in there?
I don't think surgery will help anything, because
you should create arthritis. That's when I tell patients, I'll go, clean out scar tissue and debris of the meniscus and whatever, like it's all frayed and whatnot. I'm like, that's creating arthritis. You realize that? Like, I know it's wearing out, and the definition of arthritis is the joint spaces going away, but it's like you're creating more faster. And then they just try to get you to do quad activation drills and clamshells, and then they get your full range of motion back and go, see ya, you're on your merry little way. You still are going to go sit on your hip imbalance. You're still going to lift with poor mechanics and poor...
The idea behind FixFit is understanding, trying to get on the path of figuring out why it was hurt in the first place.
Yep.
So if that is our goal, and I'm going to stick to that goal, then you might as well keep working on that. Whether you get the surgery or not, I don't care. It's your choice. But if you're doing the surgery and I ask you, why are you getting the surgery? What's wrong with the knee? 100% of the time, I've gotten this response. I don't know.
Yep.
What is the surgery going to do to fix it? I don't know. They said they're going to clean it up.
They said it's going to make it feel better.
Yeah, they said this will help it.
Yep.
And I was like, well, why is it going to help it? There's no answer. Cortisone. Exactly. And it's like, to me, it bugs me, because yes, we have to have, it's going to take time for people to change the way they think, but this is our mission. It's like, if you keep asking those questions, and if they give you a valid answer that this is caused by that, and if this will completely fix your knee moving forward, then go ahead and do it. But I'm sorry that those answers aren't there for you, because they just say...
That's the thing, is don't look for a quick answer. If you walked and played sports for 12 years on an imbalance, don't expect 12 weeks for it to change and fix and be strong overnight, or be strong in 3 months. It's like, it's not going to happen. It's going to take 3 years. It might take 12 years, you know? And it's like, and what if you're still, every person's so different. If you're like, I played gymnastics, I did gymnastics, and then I did cheer where I was jumping and landing, and then now I'm a CrossFitter for 6 years, but I did that for 20 years. It's like, you never gave those joints a rest anyway, so it's like, you need to try something different.
Change the way you move,
because you've been moving improperly for 20, 25 years, and it's like, it's not going to change that fast.
There's so many people that this like breaks my heart, because there's like families of members, or you know, uncles and cousins and whatever, significant others, like their knees are fucked, and I don't disregard it. It's bone on bone. They have to take pain meds or this or that.
Yeah. So
they're pretty much screwed, and the only out is like knee replacement, right?
Yeah.
I want to work with those people so bad, because what if you're moving better, and then when you walk there's no more pain?
Yeah.
What if you can sit down and get up without having to take fucking 800 milligrams of Advil every day?
Yep.
What if you can avoid knee surgery replacement, which is they'll tell you get one knee and then, you know, X amount of years your other knee goes. It's like, I want to work with those people, because why not? You're just doing, for me, if you come work with me, you're just doing exercises, and if you could do it without pain, then
it's so funny.
I would take that risk on exercise, and maybe you'll prevent surgeries.
You know what's nice? I was just watching a Yankee.
No matter how far your knee is gone.
I was just watching the Yankee game yesterday. CC Sabathia is a very large man. He's like always been 300 plus pounds, and right now he weighs 280, and he has severe arthritis of his right knee because he's left-handed, so he pounds on that knee over and over.
Yeah.
And they asked him, when you retire, it's his farewell season. They said, when you retire, are you going to get a knee replacement? And he said, it's on the books, or not. It's on the, it's on the whatever for him.
Yeah.
Menu, like possibly. But he was like, once I stop playing baseball, this is what he got quoted yesterday saying, which I loved. He's like, once I stop playing baseball, where I stop pounding on that knee over and over and over again, he's like, I'm going to lose weight, which I thought was funny because he's like 280 pounds, right? But think about this. Even when he was a power pitcher his whole life, so he's like 320 pounds, just fastballs. Like he was dominant for a long time, Cy Young winner, Hall of Famer. But then he got to a point where that caused his knee pain. He had to change his velocity, so his velocity kept going down, down, down. He had to lose weight, but then he also was like, I can't get too skinny because
the performance.
Then you lose the performance. So he's like, I'm at 280. He's going to be one of those like those NFL guys that like lose 120 pounds when they're done being offensive linemen. Have you seen those guys? Like Nick Hardwick on the Chargers. He's like, he runs like triathlons now, and he's like super skinny.
That's so weird.
But he used to be like, if you see a picture of him in football, he was massive, like heart attack waiting to happen, and now he's like clean cut, shredded, you know. And he's all about fitness and health, of course, because they figure out how bad that lifestyle is for them for a short period of time. But CC said, I'm going to lose weight. I'm not going to travel anymore. I'm not going to pound that knee. And he's like, so I'm taking away baseball. And he's like, and once I lose weight, he's like, I have a feeling that if I get to just exercise, eat right, and not play baseball anymore, that I won't need that knee replacement. But he's like, the cost of his Hall of Fame career, if it's so severe and it still gives him pain, he's like, I might have to get the knee surgery. That's what he would trade any day. And any baseball player in the world that you talk to was like, would you want a fake knee one day to get into the Hall of Fame? They'd be like, sign me up 3 times for that. Are you kidding me?
They'll do it.
In a heartbeat. They wouldn't even consider it.
See, that's the thing, is that mindset is like, okay, I'm going to just lose weight and do exercise, right? And that's what you've been taught, so that your knee, keep it moving. Mm-hmm. But if he's not going to move properly, he's probably going to still need that knee replacement. Well,
I know some people, dude. I'll just send this over. We'll send this podcast to him, and then maybe he'll listen, and then we'll train him. Marie, my wife, taught him his nephew when we lived in San Jose. So I'll have her reach up to some peoples. I know some peoples. We'll get this YouTube over to him.
There's a lot of the people I've been working with, they're like, oh, why don't you work with these people or become more whatever, get yourself out there. And it's like, there's no fame or glamour in my mission, in a sense, because I want to, again, get someone's uncle that's given up on moving because they have to take pain meds every day, and they're just doing that so they don't want surgery.
And they go, surgery's my last option.
And I'm not going to do it.
We love hearing that.
I can't do it. I can't go hiking. I can't. Like, I'll just have to walk and go to work in pain. I want to help that person, and I've helped a lot of people like that. They don't have those chronic pains anymore, doing simple drills. and still finding a way for them to work out without aggravating or more wear and tear because the knees already beat to shit.
Yep.
It's like that's not the glamorous part. The issue is that you'll never, like, it's not never, but it's so hard to get to the famous people because it's so...
Yeah. And they get a lot of different opinions from experts, and
my big thing is I'm tired of arguing. That's what I told this golfer I'm working with. He's like, well, what about this and this? And I was like, I'm not here to argue with anyone about what they do. They do what they do. I do what I do. We do what we do. And that's it.
Yep.
And if I had to go and dig deeper into any specific sport, I'm bound to run into that constant debate of knees out and shrugging and all that shit.
Yeah. So, yeah, our listeners that listen to this, that you've been told surgery is your last option, or PT has failed you.
Or you have to quit running.
You have to quit doing what you love.
That's what everyone does, is they quit running and they used to love it.
Yeah.
I see that. That's why a lot of people...
I won't get back into it because
a lot of people try CrossFit, and seriously, they used to be running.
Yeah.
They used to run and they loved it.
Yeah.
But they have to look for something else. And it's funny that they're thinking CrossFit because a lot of times it's like, oh, that'll fuck you up even more if you don't do it right. But
just something different.
And I always tell what I've told people in my classes, like I've went through so many different run technique training, like pose running, CrossFit, endurance running, barefoot running, all the same shit. It's kind of crazy where all of those are how to move the body, like technique wise. Pull your heel here, pick up your knee here, whatever. But you can do all of those the wrong way.
True.
And it's
so if you're a runner, weightlifter, CrossFitter,
if you have knee pain,
just knee pain.
If you have knee pain, ask yourself why you have knee pain. If there's nothing else you can take from this episode, just do that. And until you figure out the right answer, and not how to get rid of the pain, what causes the pain.
I was talking to someone last week.
Icing it will probably get rid of the pain, but it doesn't figure out why it's hurting.
I know someone that can't get hip surgery because they need to lose weight. But they can't lose weight because they can't exercise because their hip hurts. So what the hell is that person supposed to do?
They're failed by the system.
Yes. Foreshadowing. Wink, wink. For next episode.
What is the next episode?
I wish I had we need a little soundbite thing. Could have done a little like that 70s show. But yeah, we'll get into that next time when things fail you. But for this one, if you have any sort of knee pain, get it assessed by someone that you trust. And if you were told, rest, lose weight, stretch, foam roll,
more mobility,
and you're sick of that, more mobility. Or if you're on Squat University and you're save that for another episode too. Hit us up, man. Seriously, DM, slide into Mark's DMs. He's so thick. Yeah, I think you should change your name now. Mark's on Thickness. Mark's on Thick Fit. 3 C's.
Because that's my email, Mark's on Fitness, right? So it could be Mark's on Thickness. I really want to hit this 500-pound deadlift at 4th of July.
Yeah. You should.
Because like what you were saying with the baseball players or athletes, there's a lot of sacrifice that goes into it health-wise.
Yeah.
There's a lot.
We should take your blood pressure. Let's take your blood pressure before and after it. See what happens.
Getting to the ideal gain to hit the 500 pounds, I don't know what it looks like, but it's really difficult because I'm eating as clean as I can, but there's so many carbs, so much rice, so much food.
Quit crying. God damn it. What do you tell people that are like, I'm so hungry when they're fasting? What do you tell them? Suck it up. Think of the end result. What do you tell them? We're all in this together. Yes, you do. It's like all your members like, oh, keto's not working for me. And you just go like, suck it up.
I can't focus right now. I'm too sick of eating.
I'm hungry right now. You want to get some food?
Right?
Dude, you'll be fine. I'm going to get the 185 overhead press at the gym. Or at the 4th of July thing. That's my thing. I've had too many attempts at it. And then last time that left flat, I think tweaked my low back a little bit. And I was like, that makes me angry. We have a whole podcast on why that shouldn't happen.
Yeah.
And here I am. No, it's all right.
Well, that's why if you follow our progress, I mean, our deadlift has went up a ton without belt, switch grip, straps.
We've talked off there.
It's not the smooth transition that everyone hopes for, the magic pill. It's like, this has been we're doing the same trial and error. We'll have things flare up and it's like, fuck, my glute's not working. Fuck, my oblique on my left side's not firing.
I think we talked about that off air. Maybe it was on air. That we put a lot of fucking pressure on ourselves too, talking all this shit like this. So if we don't PR, or if we do get hurt, I'm always like, what's going to happen? We have an episode on, no, that'd be nice. You know, the gift of injury. We talk about ourselves going like, hey, I'm dealing with a low back strain right now.
Again, at these limits.
Because we're not perfect.
No way, my hamstring is way overdeveloped on my left. Like, when I demonstrate these things, I can and tell my class. Like, if you've been in one of my FixFit classes, I show people all my imbalances.
That's true. You do that. And
I show it online. And when I press overhead, you know, one oblique and Terry's isn't firing glute, so that's why it's crooked.
Maybe I need to do that, not show like, hey, I got everything down here. I'm the expert.
The funny thing is, the more you've done anything, aka that athlete label, right, the more messed up you are. So if you've CrossFitted for 2 years, 3 years, if you've done jiu-jitsu, if you've done soccer or played any sport, if you've been a runner, you're more messed up than the person that hasn't done a damn thing.
Yeah, but I would argue too, though, that
you're going to adapt faster.
You're going to adapt way faster, which is so fun to work with too, where I'm like I told you, that guy I had to do an RDL recently where I'm like, look at that thing shake. Now, if you just do that, I mean, if I followed up with him in like a week and I said, did you do those with a kettlebell in your hand too? He'd be like, yep, every day, 3 sets of 10. Look at it now. And I'll be like,
they know how to train. They know how to train, and they know how their body feels.
Yeah.
That kinesthetic awareness, so they can adapt to these things quicker.
Yeah.
But it is such a hard, and because how many hours did it, like a football player, you know, that just went to college, how many same movement pattern, or a golfer, right? Oh my gosh, if you have a golfer for like even 10 years, that's the same swing on one side. It's so difficult to combat that, in my opinion.
Yeah. Yeah, let's wrap this up. Whether you're in shape, out of shape, we're here to help. That's what FixFit's all about. God, that sounded way too corny. I don't want to end it like that.
I want the last ditch cases, right? Like if you know someone that's about to get knee surgery, or that's the only thing they have, but they really don't want to.
Yeah.
Why not? Like, I'm here to. I want to work with those people.
You know what? Since I don't want to fucking end it so corny, I'm gonna show you what's happening. I'm on my phone a little bit for people on YouTube because we have that photo shoot at 12:30.
Yeah.
Can you notice my face is a little red?
Yeah. Looks like you look like me
at B right now, dude. Oh, B, if you're listening, you are. I don't want to put it.
I now understand the rescheduling.
We have to reschedule it because we went to Mission Bay yesterday and it was overcast, so no one put on sunscreen, and the sun came out later, and then everyone started putting on sunscreen, right? And then
late.
My shirt was like this a little bit.
Damn.
Yeah, look at that little farmer's tan. If anyone could see that stuff. Someone was like, "Oh, your arm looks red," and I was like, "Oh shit, okay." So I pulled up my sleeve, like, let me try to even that out. And then when we got home, Maria was like, "Oh shit, your face," and I was like, "It's not that bad." And I want to see what I look like in the morning. You can't tell, right? Not that bad.
If you keep your farmer's,
if I keep my farmer's tan down. But we didn't wear tank tops and stuff because it was like actually chilly, right? Yeah, but the overcast layer, you always forget, especially by the water.
Yep.
So much worse, dude. So everybody
FixFit can't fix that. Sunburns.
Oh my god, we are so burnt, and everyone's freaking out right now because our photo shoot's in about an hour and a half. And I call it photo shoot. We have to take one quick fucking team picture from my website, and it's like attempt 3, now 4, now 5, and I just fuck.
Yeah, that stuff's difficult.
Now we're all lobsters. So, and then the photographer, shout out Shiloh, she was like,
black and white filter.
She was like, if anybody looks like lobster face, like, we should probably reschedule. And I'm like, nah, I haven't heard any complaining yet. And then as soon as we start this podcast, my phone is fucking blowing up with, oh my god, my fucking whole face and chest. White people, man. Can't work working with these pasty asses. My French olive skin is looking nice. I'm dark already.
It's pretty red.
Fuck off. I'm half white. All right. All right, we're out.